Okay, it's 9:30 and it's Friday morning, the 7th of April. It's the EdgeTalks series, and we're going to be looking at Nobody's Patient and by Leigh Kendall, Catherine McLennan, and Jill Phillips. This is going to be a fantastic session, one that I'm really looking forward to. And I'm hoping that we will be joined by as many people as possible because this is such a really important subject. My name is Janet Wildman. I'm going to be the host for the session today. I'm just quickly moving forward. So joining in today and beyond the viewers going to join the session, please use the chat box to contribute towards the discussion. We'd really like to hear your opinions around what's happening with maternity care services in your area, and what's your experience of using it, or any member of your family who might have used it. Please also join us by using the Twitter hashtag #EdgeTalks and the handle @SchoolForChange and the user @the_EdgeNHS. So please join us either on the live session or let us hear your opinions about why this is such an important subject to you by joining us on Twitter. So, as I said, the theme today, this is me. I'm the chair for today's session. My name is Janet Wildman. I work in the Horizons team. We're also joined by a few of our colleagues here, Dominique Cushion and Lewis Warner, who's going to be looking after the Twitter activity and reporting back into us around the conversations happening there. Also, I'd like to introduce you to Paul Woodley, who's going to be providing any technical support throughout the session. So if there's any difficulties joining in, you can actually contact Paul directly, and he'll see to any issues you might have. So, without any further ado, I'd like to really introduce you to Leigh Kendall, a patient leader. She's also a member of our team in Horizons, but she brings a personal story to her work, and we're going to hear a lot more about that today. We're also going to be joined by Catherine McLennan, who's the founder of the Pinks N Blue CIC, and also Jill Phillips, who's also the creator of Who's Shoes. They make a fantastic team, and they're going to be our key presenters today on EdgeTalks. We're going to be hearing a lot more around this important subject, Nobody's Patient, improving care and experience in maternity services. So, without further ado, I'm going to hand over to Paul Woodley, who's going to take us through a poll. So, over to you, Paul.
Good morning, everybody, and welcome to this month's EdgeTalks. Leigh will be leading the session along with Catherine and Jill. So what we'd like to do at the start is just have a quick poll to find out who's joined us today. So I'll be opening the poll now, so if you have a look down in the bottom right of the screen, you should see a poll pop up. So if you can just click down so we know who's joining us. And then, Leigh, if you'd like to start introducing your topic while people are completing the questionnaire. Okay, we've had the results back, so most people who've joined us today are either patients, and then there are a few others as well. So if people can put in the chat where else they would like, where they work from. And then over to you, Leigh.
Lovely. So it's good to see there is an interesting mix there. Moving on to our next slide. As I was saying, we are missing our consultant obstetrician, Florence Wilcock, who is such an integral part of MatExp. We'll be hearing more about Florence when we talk about the workshops and things later on, but for now, it's over to Catherine to tell her story.
Good morning, all. I'm Catherine, and I'm mum to 6 forever babies. I got involved with the Nobody's Patient project through a conversation that I had with Jill on the train, telling her about my experiences of loss in the 2nd trimester. Through my experiences, I've shared quite a lot of the heartache and the rough times that I've actually had while I've been on my journey. And one of the things that I did was I wrote a piece which was for a perinatal mental health talk that I was giving a few years back, and Jill got in touch and said, can we take a bit of that and make it into a poem? So I'm going to share that with you this morning. I know lots of people have heard it before, but it's always good to remind ourselves of the things that when they go right really, really help in our care. The doctor who guided me through every aspect of my care and gently told me there was nothing that could be done for my baby, who when he returned on shift came into my room and simply said, I am sorry. The paramedic who gently took our baby from my hands and said he would make sure our baby was looked after, but he needed to look after me right then. The A&E nurse who asked us if we would like to see our baby and hold her. The healthcare assistant who painstakingly tried to remove all traces of dried blood from me whilst allowing me my dignity. The student midwife who sat with me in the hours I still had hope and when that hope had gone. The midwife who brought our son to us, showing the utmost respect for him and us. The porter who gave my shoulder a squeeze when I was being taken for a scan. The consultant who rang every morning and night, despite having seen me at least 3 times during the day, and coming in on his weekend off to see how I was. The GPs who have just been there and fought for me when I couldn't do it for myself. The psychologist who went above and beyond to sit with me in my pain and sadness. The pathologist who arranged for us to bring our baby home and told my husband he knew the pain as he had been there too, and it was okay for him not to be strong all the time. And I think that the project has really highlighted the things that work and help people in these really difficult circumstances, and that the power of compassion and care can actually really help in the experience of trauma during these times of our lives. So that's my bit for now. I'm handing over to Leigh, I think.
Thank you so much, Catherine. That poem is always so moving, and as Catherine says, it so succinctly describes everything that is so important in care, and most of the things that speak about kindness and compassion. So I'd just like to introduce my story. So hello, my name is Leigh. I'm Hugo's mummy. Sadly, Hugo is not with me. He died when he was 35 days old. In February 2014, I was 24 weeks pregnant and went to a routine midwife appointment, from where I was sent straight to my local hospital. And there I was diagnosed with HELLP syndrome, which I've never heard of, but basically it is a rare pregnancy disorder that causes multiple organ failure if the baby is not born. So my son, Hugo, was born by emergency cesarean section 2 days later. I'd been sent to another hospital 2 hours away from home by a blue light ambulance. And I'm forever grateful to the staff in 2 hospitals who saved my life and gave Hugo the best possible chance of survival. But there were so many things during our care that made a difficult situation much, much worse with the lack of communication. I'd just like to read something to you briefly that succinctly describes how things felt. When I was in intensive care after my baby was born, I was recovering from HELLP syndrome and needed an emergency cesarean section under general anaesthetic when I was just 24 weeks pregnant. I felt very alone, scared and vulnerable. No one would take me to see my baby, who was very poorly in the neonatal unit. No one understood, and it felt like nobody cared. Of course they did care, the staff care very much, but the trouble is, I fell between the cracks of the services, and I discovered afterwards there are lots of other women like me as well. So I've made it my mission to help improve that for other people, which is why MatExp is so important to me. And I discovered as well that, of course, staff can't make improvements on issues about things they know nothing about. So it's really important to share that and keep that open dialogue. And I'm passing over to Jill to talk more about MatExp.
Hello, my name is Jill, and MatExp has been an incredible project, so where to start really. But I think the phone call that I got from Florence Wilcock back in 2014, saying that they'd been watching the work that I've been doing around dementia care, was very exciting, and it meant that I could expand the Who's Shoes work into maternity care. And Kath Evans, who's patient experience lead at NHS England, was an incredible catalyst here, so I'd like to thank her too. And really what the key issue was at the time, and remembering that this was ahead of the National Maternity Review, Florence told me that she was the patient experience lead with the London Clinical Network, and that at the time 6 of the 7 worst trusts in the country in terms of CQC results were in London. Although Kingston Hospital, our own hospital, was good. So they were looking at innovative ways of trying to improve maternity care, and in the light of obviously various very important reports. And this was before maternity had such a high profile. So to see the way things have evolved over the last couple of years with the National Maternity Review and more recently the Maternal and Neonatal Health Safety Collaborative has been extremely exciting. And to be honest, we'd like to think that our work and the MatExp community, which has been fantastic and so strong on Twitter and on social media, bringing everybody together, has had a very big part to play in that. So wrong is wrong, even if everyone's doing it. This has been Florence's mantra all the way through, and I think MatExp has really been pushing the boundaries in terms of looking at things like, for example, I think one of the incredible successes has been supporting Jenny the midwife with her Skin to Skin campaign. And Skin to Skin for new babies was not the norm, and particularly in a theatre, operating theatre caesarean environment, and now it's becoming much more so. So right is right even if no one's doing it, and I think Skin to Skin would be a fantastic example of that. And on the right we've got one of the extraordinary graphics that we've had the privilege of having throughout our workshops. Who's Shoes has always been about working collaboratively, bringing people together as equals, regardless of who they are. And I think my key point probably would be that it's all very well to say that and to talk about co-production, and so many people do, but actually the key thing is to create the environment where that can actually happen. And the Who's Shoes board game, which some of you might know about, literally gets anybody sitting around the table together, talking as equals. And MatExp has taken it, I think, to a whole kind of new level in terms of it's always been fun, it's always been collaborative, it's always been inclusive, but we didn't previously have a MatExp bake-off with cakes, and we didn't previously have lemons as fun, and some of the wacky stuff that you'll see if you follow us and join us on Twitter. So I think to actually create the conditions where people really are equals, and then you see some extraordinary conversations opening up. And I think that the fact that it's not just the user of the service, in this case the women and the families who are important, but you've got to actually create the conditions for staff to talk openly, and for them to want to be fired up to come to work in the morning, and to make everybody kind of feel equals, and that they can all work together collaboratively to make a real difference. And it's very, very action focused. So what is Nobody's Patient? Well, Nobody's Patient was very exciting in that we, along with everybody else, got the chance to apply for the National Maternity Challenge Fund. And this was a year ago, only a year ago. Goodness, is that all? And we had 2 weeks to put together a collaborative bid. And I think at this point, this was when all the success, if you like, and all the genuine collaboration of MatExp came to the fore. And we were able to kind of cash in, if you like, on genuine collaboration, so that, for example, we had 2 weeks to put together the bid. Florence got the idea that she'd always been aware of women and families falling between gaps in services, and I'd always been aware that with Whose Shoes, we'd done some generic maternity scenarios and poems, hopefully with some kind of coverage of all the key topics, but there was always the scope to drill down and talk about any particular issues in more depth. So Florence identified women and families falling through gaps in services, and the London Strategic Clinical Network, I think, probably were pivotal to this. Donna Ockenden and Donald Peebles, who are the two co-chairs of MatExp, wrote us a letter, an A4 letter, in response to our draft bid, which we put together pretty quickly, saying pretty much go for it. And I think that was incredibly significant in that if people like that had wanted to take longer and dot all the I's and cross all the T's and find out exactly what we were doing and how we were doing it, it wouldn't have happened. And I think in terms of the collaboration, the strongest point has been collaboration with women from the outset. So not just Catherine and Leigh, but the whole MatExp community. And just to name one or two, people like Helen Calvert and Emma Jane Sassaru and Suzanne Remick. So Catherine and Leigh, I don't know if you want to say something about how you got involved.
Yeah, thanks, Jill, for that brilliant whistle-stop introduction about MatExp. There's so much to talk about. Yes, I got involved with MatExp after my son Hugo died. I wanted to make a difference. I work in the NHS, and I could see that there were some ways that we could easily improve care and experience for families like mine. And so after Hugo died, I made a complete nuisance of myself on Twitter, badgering people to listen to me. And I found Jill and Florence, and also Kath Evans, Can Do Kath, NHS England, who's been absolutely fantastic and supportive as well. And getting involved, getting my voice out there. But of course, it's quite difficult to be able to really to get into these organisations. So when we had the bid, it was absolutely fantastic that we had a way, we had some resources to really to make that happen. It was absolutely extraordinary. I cried when I found out we got the bid. Because it's been 2 years since Hugo had died, and while that's not very long in NHS terms, it felt like a really long time for me, for making a difference, helping other families not go through the additional stress that I had done as well. So to feel important, to feel listened to feel not poo-pooed, which I've done so often before. Or be told that you're too soon for me, or I wouldn't be able to get involved properly because I'd be too emotional, or things like that, very patronising. It was amazing to be involved as an equal and to collaborate with these fantastic people and actually make a difference and not be a token person as well. Just pass over to Catherine and see if she'd like to contribute to anything as well.
Hi, yeah, I mean, I got involved with the bid after, as I said earlier, a conversation on the train with Jill. I'd been quite angry about the National Maternity Review because I've been involved in discussions around loss in pregnancy and how that fitted into the scheme of things around maternity services, and the sort of with second trimester loss we were falling between the gaps of gynae and obs and sort of not quite fitting in either. And I shared all of that with Jill, and I'd actually opened myself up to the maternity review in terms of my experience, and to find out that there was nothing or very, very little in the actual report around bereavement and pregnancy loss made me really, really angry. And so that's where the conversation opened up. And for the whole of the train journey from Manchester back to Birmingham, Jill really listened, and she really asked questions about what my experience had been and how it had made me feel, and said that she would try and do something so that I could have a voice and that I could speak out about you know, my experience and the experiences of the families that I work with as well. So I got a phone call saying we've done the bid and we're just waiting to hear, and then a phone call said it's been successful, and I was so pleased that I finally felt that I'd been listened to, that somebody was taking my experiences seriously, and as Leigh said, that I wasn't just being passed off as somebody who's got rather emotional and, you know, sort of like, you know, needed some time to get over my losses. I'll never get over my losses. What I do is I move forward with my life with my losses, and you know, being part of this project and going around to the different hospitals and sharing my experience has been really heartwarming to see, you know, health professionals just listening and really taking in my experiences and how it made me feel and taking that back to their practice. So that's my bit. And back to Leigh.
Thank you, Catherine. So we're just moving on to the next slide, where we're talking about the 3 key groups that we identified for Nobody's Patients that typically fall between the cracks of services. So we have, first of all, families with newborn babies in neonatal units and in paediatrics. That's quite key in terms of any outcome from neonatal units. Sadly, my son died, but you know, whatever outcome there happens to be, whether the baby is premature or poorly at term, you know, those families feel very much torn, because nothing is normal, in inverted commas, for want of a better word. So, and you're thrown into this uncertain environment with a very poorly baby, you're thinking, what on earth do I do? And also paediatrics, because when a baby is poorly but is discharged home and needs to go back into hospital, they go not to neonatal but to paediatrics, and when there are things like breastfeeding, a lot of paediatric departments unfortunately aren't set up to support that properly. So again, new mums often feel you know, that there's no one there to help them. And the second area is women faced with an unexpectedly serious illness, sometimes life-threatening, in pregnancy or the immediate postnatal period. So there's things like I had with HUD syndrome or preeclampsia, or there's a range of other things like, for example, you know, postpartum hemorrhage, and a range of you know, mental illnesses as well that can threaten women's lives. You know, in this day and age, we like to think that pregnancy is something that you sail through, and everything is fine. And so to be sick in pregnancy and or lose your baby in pregnancy is absolutely horrific, and it's quite a lonely place to be. And then finally, I'll pass over to Catherine for this one, I think, because she's best to talk about this part of things.
Sorry, I was scrolling through the chat then. So women who miscarry in the second trimester, as I mentioned briefly before, there's there is no parity across hospitals about the stages of when a woman who is experienced loss in the second trimester is between gynae and OBS. So there's a huge gap that we are still, and women still are falling through, that because of hospitals, some will take people under OBS at sort of 12, 14 weeks. In other hospitals, it's 22 weeks, and so women can be actually sat on a gynae ward after having just delivered their baby. Some may even be on the postnatal ward. We know that that's not as common now, but it does still happen. And then the other aspect of it for me was about my mental health, in that the perinatal mental health wouldn't take me because I didn't have a baby, and the community mental health team didn't know what to do with me. So I always felt that I was being pushed and pulled from one to the other, and nobody would take control of my care, and I needed somebody to do that. I was at a very vulnerable time, and through sharing that experience with others, finding that they also had very similar experiences, and that sometimes the gynae wards just weren't geared up to bereavement care, so care was actually quite poor. If you ended up going through delivery suite, then you tended to have the bereavement services. And so I've been doing a lot of work campaigning around that, and training to look at how bereavement services are delivered. And the language that's used around second trimester loss, miscarry for me is just not the word that describes what I went through. I've had miscarriages, but I've had second trimester losses, and the language such as incompetent cervix, spontaneous abortion, therapeutic abortion, all those words really hurt. So that was where I was coming from in terms of my input, and sharing the experiences of others who had gone through similar losses.
Thank you, Catherine. That's really powerful. And I think that really underlines the power of MatExp for Nobody's Patient. Now we can collaborate and talk between ourselves to discover that we weren't alone, even though we felt very alone when we went through those experiences, to empower ourselves to understand that, unfortunately, these aren't unique circumstances. For example, when I was in intensive care, the staff really didn't know what to do with me. They looked after me as a patient very well, but they didn't take into account that actually I was a new mum and I needed to be with my baby. And when I made a complaint afterwards, I was told, well, we've never had a problem like you before. And to tell a patient, a human being, that there are a problem is one thing, but also if people don't feed back about things, then people can't actually do anything about it. And that is one of the key issues, that there's such emotionally and physically draining experiences, things that people don't like to think about or talk about. So they're very much in the shadows, and so that's why services are very linear a lot of the time. And so when people fall between the cracks, like Catherine was saying, some are in gynae, some are in postnatal, and with families in neonatal units. So who looks after you? Does the community midwife come and look after you, or is there someone in the neonatal unit? And with intensive care as well, you're outside of maternity, even though you need maternity services. So where do you fit? You fall between the cracks, and you become nobody's patient. And it's a very lonely place to be, and it adds a lot of additional trauma and stress and anxiety and heartache onto what is already a very difficult situation. So Nobody's Patient is a direct quote from another woman, Carolina, who said she felt like nobody's patient between postnatal and neonatal staff. I'm just going to pass over to Jill to talk about how we crowdsource the feedback to create the new scenarios and poems for the Nobody's Patient board game.
I think we've got another slide with the different ways in which we source. Is it the next slide, Leigh? That's it. So basically, we crowdsource the material. The short way of describing it is from everywhere. Social media is obviously an incredible source of bringing in all sorts of different voices. So we use social media and the MatExp hashtag and the MatExp Facebook group and Pinterest and all sorts of different channels very strongly. But we also had physical events. So the top photo, I think, is that the first meeting, Leigh, at St George's Hospital?
Yes, that was the first meeting we had to talk about getting a workshop together.
I think for Florence, we were absolutely delighted to get St George's as an actual partner in the project, because this made it not theoretical. There were one or two other tertiary hospitals that we could have involved that I'd already done Who's Shoes workshops with. St George's had nothing to do with Who's Shoes or MatExp, but they were the hospital that Kingston Hospital babies and women were transferred to as their tertiary hospital. So to get St George's on board was amazing, and Leigh had a big part in that, and St George's was very significant to Leigh, as she can tell you herself. So to get the two hospitals involved, to get the London Strategic Clinical Network involved, and basically to be challenging them to be finding material from everywhere. So, for example, what were their challenges in their CQC reports, friends and family comments, and the whole load of acronyms at the bottom. For me, the most significant one is the MSLCs, because they're collaboratives that bring together women and staff already, and we could tap into what was happening locally. So the idea really was to have real conversations and to crowdsource all the Who's Shoes material, so that every scenario and every poem, as it always is really in Who's Shoes, is an authentic voice. You couldn't possibly agree with all of it because people have different views, and the power really is to hear how it affects the women and families, as you've heard so powerfully from Leigh and Catherine, but also what the challenges are for staff, what it feels like to be an obstetrician like Flo trying to make a decision about whether to transfer that mother now before the baby's born or wait till the baby's born. And these kind of really powerful messages have come through, and they've sourced our material, and I think that's what's made it so powerful. And the other one to mention is the focus group that Catherine hosted with the Pinks and Blues. I think is probably one of the smallest and one of the most powerful, most moving things I've ever been involved in, because very often it's not about numbers. We only had, I think, about 6, 7 parents came along. I think 5 or 6 mums, and one of them brought her partner, and those people had never, in many cases, met, far less talked in depth to other people who'd lost a baby in the middle of pregnancy. And we planned to have a 3-hour session with space for people to go out and take a walk and plenty of kind of space, and we ended up with a 4-hour intensive but very positive discussion that saw so many of the scenarios that led into that third stream around losing a baby in the 2nd trimester. So that's just a flavour of how we tried to crowdsource the material.
Thank you, Jill. Sorry, I was just looking in the chat box. As you say, the meeting at St George's was incredible. St George's is the hospital where my son Hugo was born and lived and died. So that was the hospital where I talk about with the problems in intensive care. And as I say, I'm intensely grateful to St George's for saving my life and giving Hugo the best chance. But there were so many issues with communication between departments, between staff, when I felt like I was a problem. I felt like nobody cared. I felt very vulnerable, scared and alone. So to get these professionals from various specialties in a room together was absolutely incredible. You know, during the time of my care and Hugo's care, it felt like these departments were not just different departments in the same hospital, but it might as well have been on different planets. So to get them all together in the same room and talking about solutions to these issues and actually listening to me and to my care and seeing the pennies drop about what went wrong and what they could do, very easy things that they could do. And to get them talking together as well, because they're all very busy people, you know, in their own specialties. They all have, you know, incredibly busy jobs. So to get them to take time out of their busy days and their busy shifts to come and talk together about how to make things better for other families was absolutely extraordinary. So I'm really, really proud of that, and thank you to all of the staff that were involved. We'll talk in more detail about the actual workshop shortly. And I'll just pass over to Catherine to see if she'd like to say anything more about the focus group.
Yeah, I mean, Jill said quite a lot about the group, and so from me, again, couldn't have envisaged how powerful the actual focus group would be. That the parents coming together and sharing their experience with such ease, and they were just so supportive of each other. It was that they gave time to each other to share their experiences. They didn't talk over each other. And for a group that had never ever come together, the respect between them was just absolutely amazing. So they talked about the good, the bad and the ugly, each sharing the most difficult times of their lives. And as Joel said, some of them had never ever even spoken about their experiences with anybody else. They had never been given that time or that place to do that. And it was the first time that they'd spoken about how traumatic those experiences were. It was an absolute honour to be part of the group, and the way that Anna, the graphic facilitator, pulled all of those conversations together and fed it back to the group just really added to the emotion of the day. And the Who Shoes cards, which Jill had brought with her as a starting point, they were just spot on, and I recognised a number of them from my experiences, and so that felt really positive that she'd taken my experiences and put them into these cards to help open up the discussion around second trimester loss. And as I said, the group coming together was just really, really important, and the numbers were small, but it was right. The information that we got from that session, we couldn't have got it with a larger group, we couldn't have got it with a smaller group. And, you know, there was a great deal of courage shown by the parents in that group through sharing their experiences as well.
Thank you, Catherine. So I'm just going to pass back over to Jill to talk about the pilot workshops. We held two, one at Kingston in July and one at St George's in September 2016. Over to you, Jill.
Okay, so this is the next part of the story. We've crowdsourced all this material, and the first workshop was held at Florence's own hospital, Kingston Hospital, where we've already done a lot of Who Shoes work, not just in maternity services, but in other work as well, such as operating theatres. They've been very innovative, and we basically tested the new material, and I think that the previous slide should be showing here. That's it. But we tested the new material, and we tweaked it afterwards. We obviously we were asking people to comment, have we got the scenarios right, have we got the poems right. At that time they were all just in prototype form, whereas the versions you can see of the poems on the screen at the moment are the final design versions that we've come up with right at the end of the project. So we had the summer period really to review the material and keep crowdsourcing a few gaps, and I think the hardest thing really was it always is with kind of producing a finished pack of Who Shoes material. People come up with such wonderful things, and you think, have we got something about cold babies? I'm not a maternity expert, I've learned so much. Colour-coded hats, family integrated care, and alongside this we were building our toolkit of basically tips as to how to get the most out of the workshops, again crowdsourced, and a new booklet of 10 best practice case studies. So the second workshop at St George's Hospital was pretty much saying, how does this work at the most intensive level of care in a tertiary hospital? And as we can in all the Who Shoes sessions, we selected the cards that we were going to be talking about accordingly, because you can actually pick certain messages and put them at the top of the pile, so that although it's random, then you're taking the conversations into things around transition and transfer between hospitals that are obviously critical to that kind of service. That's what I wanted to say about that.
Thank you, Jill. I just wanted to talk about my own experiences of the workshops, and I'll pass over to Catherine as well in a moment to share her experiences. But what was extraordinary about those workshops was the energy and the buzz. Because at the workshops we had people from all sorts of specialties, so from maternity, neonatal, paediatrics, and gynae, and some intensivists as well as parents, families, so all together on tables talking about their own experiences. And I will never forget the day at St George's, because it's absolutely just so incredible getting all of those people together. And one of the things that sticks out in my mind most of all is because when I challenged the CQC about why are bereaved parents excluded from the maternity surveys and the neonatal surveys, we were told that the reason they exclude us is because it'd be too sensitive for us to be included, too difficult. And there was so much laughter on our table. Our table included other people, other mothers who had lost their babies, but were able to laugh and to share and to talk about so positively and constructively with the consultants and the midwives and the nurses on our table about ways to move things forward to help other families. And I also remember the neonatal consultant, one who cared for Hugo, on our table, who cried when she realised that perhaps she'd not been doing something in a way that was most helpful for parents. And that was incredibly powerful, not just for her, but for us as well, to see how much the doctors do care for patients and for families, and they want so much to get it right. But we can only get it right if we share the experiences and we share what goes wrong and what could be better and how they could make things better. And we can only do that if we're included positively and constructively in a way that is, yes, it needs to be sensitive, but we're not made of glass. You know, we can, as Whose Shoes and Nobody's Patient shows, there are ways of sensitively including families like ours that is constructive and productive and makes such a difference. I should pass over to Catherine.
Very similar to Leigh, really, about the groups. They were so powerful to be there with people who really wanted to make a change and who wanted to hear our experiences. It was really touching, and the feedback that we got from people in how sharing our experience had made them really think about their own practice and how they could change that, and also the wider reach, that whilst we were in these rooms, people from across the globe were actually getting involved in the conversations that we were having as well. So it wasn't just the people in the room, it was wider, and people were learning from that through Twitter and conversations that were going on by sharing pictures of the day and photos of some of the cards and asking, what do you think about this? So there was, whilst we were in one room, we were actually in a much bigger room as well. And so that was really nice to see that feedback and to see it live happening while we were there doing the actual session. And for me, it was so important that people really wanted to understand second trimester loss. That sort of most were very comfortable around what miscarriage was and stillbirth, but not really understanding that second trimester loss. So it was a really great platform to share my experiences and those of people who I work with and talk to as well. Back to Leigh.
Thank you, Catherine. There's just one more slide, and we're going to be passing over to our Twitter and chat monitors, so just a couple of minute warning. And just passing over to Jill to talk about some of the themes using our beautiful graphic facilitation as a guide.
Okay, so it was hard to know which ones to pick out, but these ones shown on your slide at the moment have been key themes throughout the whole project. And I put it to you throughout healthcare, because if you're in hospital and things aren't right, or if communication isn't right, and obviously you're not feeling well, and there's a reason that you're in hospital, people are anxious. And this sounds like a very obvious thing to say, but I think the learning has been of health professionals to be able to put themselves in the shoes more of the people that they're serving and realise the effect of anxiety and the small things, often very small things, that they can do that are so significant in making people feel better. Language, handover notes at the bottom, and communication, people only having to tell their story once, especially when things are sensitive and they're not feeling well. And language has been incredible in the MatExp campaign. I really feel that it's one area where we're making a huge difference, and it's brilliant to see hospitals like Leeds and Colchester, who've been involved in the Who's Shoes workshops, doing local challenges, possibly with a swear box, and possibly picking certain words that, you know, for a certain period of time, we're going to make sure that nobody uses the word failure, for example. I mean, how would you be? Well, I did actually ask Simon Stevens, the Chief Executive of the NHS, how he'd feel if he was told that he'd failed to dilate, and that has made actually quite an ongoing, I don't know whether it's a laugh. I mean, I think sometimes just to be a bit outrageous on Twitter or in opportunities that we get, and the way that we embolden each other within MatExp has been very powerful, but the underlying message is obviously really, really serious. And sometimes just wording like low risk or high risk in pregnancy, you know, if you get told that perhaps your pregnancy is that you perhaps be better to see the obstetrician, and someone like Flo comes smiling and you meet her, rather than being told your pregnancy is very high risk as the opening gambit, actually probably helps people physiologically have a better birth. So learning people's names, I think Who's Shoes and MatExp goes hand in hand with the Hello, My Name Is campaign, and Hello, My Name Is applies to the people that we serve, the women and families in this case, as well as the healthcare professionals. So the one at the bottom, Outliers, has been, it just came from one workshop. Someone was told, as my mother was actually told, that she was an outlier in healthcare, which has a medical meaning, but somebody from Ireland told us that apparently in Ireland it means a cow who's put out to grass. Thank you, Anna, for that lovely, memorable graphic. Over to the next slide.
Thank you, Jill. So we're just going to take a moment to look at what is the activity that's been happening in the chat box and the Twitter box. So who is our chat monitor?
Yes, that's me. Thank you very much for that. That was such a fascinating conversation. Can you hear me?
Yes, Joanna, I can. Thank you.
Yeah, so in the chat room, it's been quite busy, a lot of issues that's been raised, but just a general sense that this is such a powerful area that we're all learning, we're all growing, we all accept that there's possibly a data gap here, and how can we actually try to look at the gaps in services by getting more data, more quantitative data. And some people have suggested doing a PDSA cycle or looking at improvement sites as a way of trying to look at capturing more data that will tackle some of the gaps and the fragmentation in services. There's something around language, and I think that you know, the way that you all presented today and talked about the power of language and trying to get the language right has been phenomenally important. And again, the issues that you mentioned around being able to think about creative way of collaborating and telling stories as a way of moving the issues forward and getting professionals from all sorts of disciplines together, that seems to have resonated with a lot of our audience. Tony has said, Tony Longbourn has said this has just been a powerful a session and one that all HCPs can learn from. So well done to everybody who's presented and put this session together. It's been fantastic. I just want to go over to Twitter to find out from Dom what's happening in the Twitter room and what can we hear from our audience who've been involved in the Twitter conversations. Over to you, Dom.
Good morning, everybody. Going through the Twitter streams at the moment, there's a lot of synthesis around the conversation that we're having. It feels like a lot of people are listening to what's being discussed. It's quite an important conversation. Jenny Hicken makes some really good comments, kind of summarizing what's being discussed by our presenters, that maternity care providers should always consider impact of language they use. Things like failure, high risk is very negative, and I think it's just kind of reflecting how we move forward and how we can make that better.
Thank you for that, Dom. Any reflections from the presenters, Jill, Leigh, or Catherine?
Not from me. We still have a few slides to go through. So, Catherine and Jill, do you have any other reflections, or should we move forward?
Move forward, I think.
Lovely.
Yeah, move forward.
Thank you.
Okay.
And Dom, for those reflections. They were brilliant. I'm really delighted to see that people are really taking it on board and really learning from this. So thank you. So what is so brilliant about MatExp? Well, it's something that people can take for any specialty that they're in. It's not just about maternity or gynae or peds or neonatal. Any specialty can take this this collaborative approach forward. Our real ethos for MatExp is no hierarchy, just people. So in the picture on the left, we have Catherine and Anna, who's our graphic facilitator, Jill, and then we have Florence, who is a consultant obstetrician at Kingston, and then we have me, and then we have Sam Fruin, who is a research midwife for the No Peace Patient Project, and then we have Michaela, who is a lovely lady from the London Strategic Clinical Network, and then we have Florence, me, Catherine and Jill, and the other photo. And what's so important about this is that there's no hierarchy, there's no bosses. We're all leaders of this social movement, and that's what's really important about the collaboration. Anyone can have an idea and take it forward. There's no very often in patient engagement, as I found, there's a very tokenistic attitude where perhaps a patient is tacked on to the end of an agenda, or you're there to be a bum on a seat, as I've discovered quite a lot, to tick the box, and you're not really given a voice. So in MatExp, and Nobody's Patient is absolutely fantastic because Catherine and I help write the bid. We're an equal partner in helping craft the agendas for the workshops, and equal partners in being involved in steering it, telling our story, having a voice, as is anybody involved in the project on social media and in the workshops as well. And it's a real model, I think, for other people to take forward, to show that you don't need to be frightened of patients. I think a lot of the time in health and care, people can be frightened of patients in terms of, oh no, they're going to come and tell us things. Eek, what might they say? And yes, of course, patients will come and tell you things, but we aren't frightening. We want to come and help you. We'll tell our experiences, and sometimes they might be uncomfortable, definitely, especially where things went not quite as they should have done. But it's so powerful. That can make a difference. You can build some fantastic relationships. I count Catherine and Jill and Florence as some of my dearest friends, and that's absolutely a fantastic way to do things, genuine collaboration and cooperation and working together as equals. I'll pass over to Jill and Catherine.
I think for me, reiterating quite a bit of what Leigh said really is the fact that we've always been a part of this process. It hasn't been being told what we need to do, I want to say, and that we have all had equal input into how we run the sessions, what we say at the sessions, and for me also it's gone wider than that. In my work that I do with the Pinks and Blues, I have to give a lot of myself, and sometimes I don't have a lot left, and the whole MatExp has given me a support network that I didn't previously have. So when I am struggling, I can talk to other people who understand what it is to have lived through trauma and to be moving forward in their lives, and just have people to lean on every now and again when things are just feeling a bit overwhelming, but also to talk things through, to have people who don't judge me, who never make me feel like, oh my God, here she goes again, has been really, really special. And as Leigh said, made some absolutely amazing friends that I would never have met in any other way, I don't think. So, you know, thank you to everybody that's been a part of the MatExp and the wider conversations across Twitter when we've hosted tweet chats and things. I've felt the support has been amazing, so thank you.
So we had a wrap-up event at, sorry, thank you, Catherine. We had a wrap-up event at Kingston just a couple of weeks ago, actually, so this webinar is very timely. So the purpose of the wrap-up event was to talk about what we've been doing for the last sort of 10, 11 months with Nobody's Patient, talk about how the pilot workshops had gone, and about some of the outcomes and outputs from those sessions, and also about the case studies. It was a really fantastic event. You know, people from both hospitals, Kingston and St George's, and from NHS England, and from SANS, and some of the other charities who've been involved as well. It was a day full of energy and buzzing, and you know, people really inspired about what they've learned already from the Nobody's Patient project, and keen to take things forward into their own hospitals, because they've been given now a real example about how things can work with these sensitive issues, with these people who normally fall between the cracks, that, you know, there's no such thing as a hard to reach group. You know, we're all here, we just want our voices to be heard, and it's about finding a way to get those voices heard in a way that is useful for every party. So for useful for the staff in the hospitals and useful for the parents as well. You know, as Catherine has said as well, it's a way of using our voices and our experiences for good, and not, as Catherine said, you know, there she goes again, you know, where I felt a bit like that myself at times. You know, there's people who actually want to listen to what we have to say and, you know, really take account of it. And it's such a positive example, I think, of how this can actually happen, and some real positive examples of things we can take forward. And just in a moment, I'm going to pass over to Jill about the toolkit and the best practice case studies, which is how we're sharing that learning.
Okay, great. If I could just say a massive shout out to Florence for the wrap-up event, because that wasn't included in our original bid. There was no need for us to do that whatsoever. But I think there was a constant kind of asking, well, what difference is the project making? And we thought to have a bit more of a kind of appreciative inquiry approach, and actually have an event to bring everybody together would be brilliant. And that's an example of how Florence works, really. So we wanted to show off our new toolkit, which had come back from the printers, I think, 3 days before the event. And I can prove that because it has printed pictures of a workshop that took place in Leeds with young parents on the 7th of March. We're very, very keen to get it bang up to date. And similarly, our new book of case studies, best practice case studies that have come directly from the Nobody's Patient project. So we've now got 10 MatExp case studies from the original project, and another booklet of 10 case studies from the new Nobody's Patient project. All of these materials are available online, free of charge. There are 20 case studies there that any hospital could basically say, we could do that, or we could do something similar, transferable knowledge and learning that people can run with. And the network that sits behind it is extraordinary, with hospitals talking to each other in a way that perhaps they didn't previously. And the other thing I wanted to mention is it chance? Is it that we're influencing things? We're absolutely delighted that the new Maternal and Neonatal Health Safety Collaborative, a brand new 3-year government programme that all hospitals have got to get involved in, has just been launched. And it's looking at the gaps between maternity and neonatal care. And lo and behold, the brand new Nobody's Patient material has just been launched. And it's very, very positive that the team there at the NHS Improvement Team seem to be a wonderful team and really valuing the work that we're doing. So I can feel a very strong collaboration building there. And they invited us to come along and run workshops at their launch event. That's Florence and myself as it happened. But as you can probably tell, we've got a pretty interchangeable team. And if you get any of us involved, then you'll get the same kind of energy, hopefully.
Thank you, Jill. Catherine, is there anything you'd like to add about the wrap-up and the case studies?
No, I think you've both covered it really, really well. Thank you.
Thank you. I can see we're at time, so I'm sorry if I'm taking up anybody's days. But we're actually near the end, and we're doing pretty well, actually, because all three of us could quite happily talk about this all day. So if you want to stay, you're more than welcome, but we are near the end. And just passing back over to Jill again to talk about some very timely events that have been in the news.
So I think this is a great example of how we try to keep, bang up to date, and there is always something happening. So at what point do you publish that booklet? At what point do you sign off this presentation? And I'm one that I'm known for adding a slide right at the last minute. And sure enough, this was on Tuesday, and people were tweeting about this wonderful news. It was on the BBC, and the hospital, which is Leeds, where parents care for premature babies. Now, hopefully you can tell that in the context of what we've been talking about, one of the earlier slides, if you look back afterwards, has got a poem called Theoretical Mummy. How awful, what a terrible start to life as a new mum. If because you happen to have a premature or sick baby, you feel like a theoretical mummy. And think of the implications in terms of bonding and mental health and the long-term future of that family. So family integrated care is pretty much the opposite of that, getting new parents involved in caring for their babies from day one, however sick and poorly they are. And this was featured as big news on the BBC on Tuesday, but we were delighted that we'd already got the case study from Leeds, so about exactly the same example in our printed case studies the week before. So back to you, Leigh.
Thank you, Jill. I was delighted to see that in the news. It was absolutely fantastic to see how organisations are taking these things forward and making a difference for families. So that's absolutely brilliant. So just there's one final slide here, which is a call to action. So thank you ever so much, everybody, for listening today. And my call to action is that nobody, irrespective of specialty, should ever feel like they are nobody's patient. So as you've heard Catherine and myself talk today about our own experiences with our own care, we had so many instances where we felt very alone and vulnerable and scared. And of course you're going to feel lonely and vulnerable and scared at various points in your journey when things perhaps don't go quite the way that we wanted to. Losing our babies, no one wants to go through that. And they couldn't have been avoided. But what could have been avoided was the way we were made to feel, because the communication wasn't right, because the language wasn't right, because we weren't in the right specialty, being cared for in the right place, and because the staff didn't quite know what to do with us. And nobody should ever feel like that, no matter who they are and whatever specialty they are in. And I would like to invite you to think about what you will do to ensure all voices are heard, so nobody feels like they're nobody's patient, whatever specialty they are in, and that nobody feels like they're a token in engagement, and that everybody feels like they have an equal role to play in sharing their story and to help other families and other patients too. Thank you so much for listening. Jill or Catherine, are there any final observations or comments you'd like to make before we pass over for questions?
Just like to say thank you for everyone who's joined us today live here and who will join us at a later point as well, and hope that you can take something really positive from our experiences to make a difference in your own practice. Thank you.
I'd just like to say thank you as well, and to point out to people again that this goes way beyond maternity services. It's to do with anybody, all of us really, wanting to experience the best we possibly can from whatever health needs and healthcare services that we happen to come across. And let's work with the professionals and let's do true co-production.
Thank you so much, and thank you to Jill and to Catherine for being awesome, fantastic co-presenters as ever, and to thank you everybody who's been listening live. And I really do hope you take some positive things away from this to your own care, to your own hospitals, and go away and tell everybody you possibly can. I'll pass back over to Janet to see about next steps and to take any questions.
Thanks so much to everybody, to Leigh, to Catherine, to Jill. A big hand clap all over for such a powerful, moving session this Friday. Don, can you just give a final word on what's happening on Twitter from your end? Hi, Don.
Hi, it's Lewis here. I think Dom is having a bit of a problem. I'll talk about what was happening on Twitter. So I was managing the Edge account. There's been some great conversation. I think it's really interesting to see how the chat has been really intense. I think that shows how passionate people are. It's just they want to get the message across straight away. And on Twitter, we've been talking about some of the themes that have been discussed within the Edge Talk today, such as the use of language and how that's really important. So I've put out a tweet to ask how practitioners use language and how they can think about language more, and how it's maybe one patient to them, but to the actual patient, that's their whole life from now on, that contact. So really interesting and poignant points today on Twitter. Too many. Yeah, thank you.
Thanks very much, Leigh. I appreciate that. So thank you to everybody. I just want to remind all our audience that the next Edge Talk is going to be on the 5th of May, and it's going to be led by a gentleman called Chris Godwin, who's a filmmaker on behavioural change in health and care. He's going to be looking at transformational change using film. So please join us on the 5th of May for our next Edge Talk. So for now, I just want to again say thank you to all the presenters, say thank you to all the Horizons team that has supported behind the scenes, and I wish that you all have a wonderful weekend. It looks like it's going to be a sunny one, and so all the best to you. So thank you and goodbye.